Let us now go to visual diagnosis of the fingers. The topic is contraction of the fingers. Thickened or swollen fingers can be caused by phlegm or dampness. They may also be due to edema, but this will usually be periodic and sporadic. Phlegm dampness can often manifest with chubby fingers. Other causes of swollen fingers can be cold or damp B. If there is cold or damp B, there will also be pain in the fingers that is affected negatively by cold weather. Fingers that are spoon-shaped are usually an indication of a chronic lung imbalance. It may be phlegm cold, phlegm heat, or a lung and kidney deficiency. Very thin fingers may indicate stomach and spleen Qi deficiency. The fingers will be thin because the muscles are malnourished and withered. The joints in the fingers can change shape or become swollen or gnarled when there is a chronic B syndrome if the stagnation has led to the formation of phlegm in the joint. Contraction of the fingers with normal movement of the wrist joint and all the joints above is called chicken claw wind. The most common cause of this contraction of the fingers is liver blood or liverine deficiency. Dupuytren contracture of the ring or middle finger is a typical example. Here is an example of a contraction of fingers. Two other causes of contraction of the fingers are cold in the joints or stagnation of qi from emotional problems. In the latter case, the contraction of the fingers comes and goes according to the emotional state. When contraction of the fingers is due to liver blood deficiency, there will also be cold hands, tingling of the limbs, dizziness, blurred vision, floaters, numbness or tingling of the limbs, scanty menstruation, dull pale complexion with a pale tongue, and a choppy or fine pulse. When the contraction of fingers is due to liverine deficiency, there will be thinning of muscles, hot palms, tingling of the limbs, dizziness, blurred vision, floaters in the eyes, dry eyes, scanty menstruation, dull pale complexion but with red cheekbones, withered and brittle nails, dry skin and hair, night sweating, normal colored tongue without coating, and a fine or floating empty pulse. If it is due to blood stasis, there will be pain in the hands that is worse at night, rigidity of the limbs, purple tongue with a wiry or choppy pulse. Contraction of the fingers due to liver wind will have unilateral contraction of the fingers, unilateral numbness or tingling of the hand, tremors, severe dizziness, tinnitus, headaches, tics, stiff and deviated or moving tongue with a wiry pulse. If it is due to wind phlegm, there will be unilateral contraction of the fingers, unilateral numbness of the hand, severe dizziness, blurred vision, tremors, numbness or tingling of the limbs, tinnitus, nausea, sputum in the throat, a feeling of oppression of the chest, stiff or deviated and swollen tongue with a wiry, slippery pulse. For cold dampness, there will be contraction and swelling of the fingers, numbness, a feeling of heaviness, and cold hands. If it is due to liver qi stagnation, there will be contraction of the fingers that comes and goes according to emotional moods, hypochondrial or epigastric distension, irritability, moodiness, a feeling of a lump in the throat, premenstrual tension, and a wiry pulse. For invasion of external wind cold, there will be contraction of the fingers with acute onset, aversion to cold, fever, occipital headache, stiff neck, and a floating pulse. Thank you so much for your attention.